Hey guys, it's Dr. Paul Thomas with Plum Health DPC and Startup DPC. And I just wanted to give this a brief introduction. I think it needs a little bit of an introduction before we get to our interview with Neil of Sling Health because I'm not being paid to do this, and this is not an endorsement of the Sling Health platform. I currently don't use the product, but as a part of the series, as a part of what I'm trying to do, is I'm trying to learn as much as I can about this space and interview a bunch of different people and try to understand all the different players and all the different things that could make us more efficient, like perhaps this platform. So by doing this interview, this is not an endorsement of this product. I just think it was a really cool story. It's a cool product idea. I really enjoyed meeting Neil at the Chicago DPC Summit put on by the AFP, and I really thought you might enjoy this content, this interview. So without further ado, here is our interview. Hey everybody, it's Dr. Paul Thomas with Startup DPC, and I have a very special guest, Neil Batlivala. He's with me from Sling Health, and he's talking about how to improve your processes in your direct primary care practice, how you can get rid of some of those inefficiencies and improve your workflow. I met Neil recently at a conference. I think it was the DPC Summit in Chicago, right?
Yep, that was it. Yeah. All
Awesome.
the whole DPC crew out there.
Yeah, it was cool, man. And I think you have a really innovative product, a really innovative idea that could be beneficial. And I want you to walk people through it because a lot of people are struggling. When do I hire a medical assistant? How can I take care of some of these things I don't want to take care of, don't want to spend my time on? So we're going to take a deep dive here.
Perfect. Hey, thanks so much for inviting me. It was great to meet you. I think it is safe to say that when I originally walked into DPC, I didn't know what it was, but it felt like my tribe. So I appreciate you having me on the show.
Dude, I love that you said the tribe thing because I think, when you get to one of those conferences, you feel like it's your people, you feel
Yeah.
like you're walking into a group of friends that are just about to like hug you or like rub your head and like tell jokes. And, it's kind of got a distinct feeling more so than any other medical conference I've been to.
Oh, 100%. I mean, I was telling you, I've only been around for 9 months, and I feel like just because you find the people with those shared values, the shared patient-centric relationship, the shared value on, not having to deal with all of the, you know, tedium that is in the insurance-based world and all of that, just shuffling it off, you bond really quickly. I
Yeah.
have some great friends now. It's funny, every single new conference is like, it's like meeting up with a bunch of friends again.
Yeah, hell yeah. I mean, that's why I go down there. I mean, I definitely learn a lot with each one and I get to meet great people, but then you get to, you know, further those connections.
Yeah. So excited to tell you about what we've been doing, why we started it. Yeah. Where do you think we should begin?
Yeah, let's start like where did you get this idea from and what was your process of starting a business? Because I think that's applicable for everybody.
Yeah. So I'm based out in sunny San Francisco, although not super sunny right now. And an engineer. So I started my career in engineering and then moved into, I was pre-med, decided to stick to engineering and started working at a company called Forward Health. And
Okay.
Forward, if for those of you who don't know, it's a tech-centric healthcare practice. Now they've turned into some very tech forward and kind of focused on things like genetics, on different sort of hardware devices. But one of the things we did really well there, and I got to experience firsthand, was what does it mean when a patient is cared for throughout the life cycle of their plan, of their care plan. When they come into the doctor's office, they know when they're coming in. When they have a referral, they know where to go, when to go, why am I going? Just being involved and incorporated into that so that they don't left, I'm sure everyone here knows when you go to the doctor's office, sometimes they say, go to referral, and that's it. You don't really know what to do next. And I
Sure.
saw how, what an impact it made on patients when you were a supporting hand throughout it all. But
Yeah.
that's so just a lot to ask for when you are an individual doctor just trying to keep your head afloat and you're running your practice and there's so many things to do, so many things outside of the care plans that you're just generating every day, and all the visits and all the relationships you're building. There's the business running, there's the clinical operations, all of that stuff. And what we did really well at Forward was look at the workflows and say, hey, can someone else help the doctor here? And that's what we did. We had a care team that helped support these doctors. And after a little while, I said, well, after a little while, I'll kind of take a little bit of a step back here, which is to say, clearly very passionate about the healthcare system. And
Sure,
I spent a lot of time looking into the macro trends. And I said, hey, all these hospital systems are eating up these independent practices, and care is just becoming less and less local. And that's a problem. It's a really big problem. It breaks so many things fundamentally. The relationships you have with patients, just patient choice. They now have to go to these big hospital systems and pay absurd costs. And so my answer is, well, healthcare has to be local. And what better way to do it than to support independent practices so that they can compete?
That's awesome, man. I'm going to interject here.
Yeah, please.
There are some studies out there, and I'll post this as a part of like the discussion in the show notes, but there are some studies out there that show that patients get better care when they see a private practice physician versus a hospital employed physician. And I think a lot of that has to do with the diffuse responsibility. Like when you have 20, 30 doctors in a group and you're a patient seeing one of those doctors and they're on vacation or they're too busy to see you that day, you often get pushed off to a partner who you may not know that well, or the doctor may not know that well. So then that care kind of gets splintered in that whole process.
Yeah, and super fragmented, 100%. And so my co-founder and I, Cassie Choi, she's a registered nurse. I met her at Forward. We bonded very early. I taught her how to debug engineering code. She taught me how to draw blood. We were two peas in a pod right from the beginning. And
that's awesome.
We came together and we started Sling Health. And so what is Sling Health? It is what we call a virtual care team to support independent practices. And a virtual care team is a remote set of nurses and medical assistants who can work with you in your practice, impactful from day one, and help do all of that back office work that distracts you as a physician. It's the things that led to burnout in the first place. But we're also a technology company. We have our own internal tools that's focused on patient-centric care, such that we can be in that tribe with DPC, so that we're building services that are patient-centric, that are, our workflows are different.
Sure. Well, let me ask a like point blank question. What are those biggest challenges that you're trying to address as like far as the DPC doctor? What challenges are you solving for those DPC docs?
Just just when you start up a practice and you try to get your clinical operations going in a smooth way. I've talked to enough practices at this point. It's hard. It's really hard to get that going while also juggling growth and trying to get patients in the door. And, at the same time, you're giving out your phone number to all your patients and they're messaging you in about things like scheduling, which, you have better things to be doing. You should be, really focusing on the patient care and or trying to grow your practice so that more people know about DPC.
Sure.
We take all of that and we come in with our best practices, the best practices on how to make sure that a referral actually goes through. We're pretty relentless in these things. So when I say that our workflows are different, we don't just send the referral and fax it out and then forget it. We send the referral, we call the facility, we make sure that we schedule a first appointment. And that's actually kind of important. We schedule that first appointment, which makes sure it helps get people in the door. And then we text the patient and say, hey, here's your referral. Here's why you need it. Here's when it is. Here's the address, the phone number. And then we follow up with the patient when the appointment is and say, did you go? If not, should we reschedule? At that point, then we make sure the notes actually get back to the provider that the doctor that requested it. And so in that way, we really make sure that we close all those loops so that we perform that, that high touch care that DPC is, known and loved for. But we make it the responsibility of the care team, not the doctor, so that they can do their, growing of the practice and the patient relationships that really matter.
Sure. I could see how that would be a huge benefit, because a lot of times when you're trying to schedule those things, you have to take your personal time as a physician if your patient's having a hard time getting that appointment, and call the office and then communicate that with the patient. and ensure that they go. That's a lot of stuff. Now, I will say you can do that as a direct primary care physician, and you do have the time, especially when you're building your practice and growing. But at some point, this is the real core of this conversation. At what point is your time better spent on face-to-face visits, building relationships with patients, and then biz dev stuff, going to larger businesses, trying to recruit maybe a business with 20, 25 employees. And if you're spending all of your time faxing forms or on the phone with a second physician's office, you're going to limit your opportunities to grow in those other avenues. So I think that's the real crux of the conversation for everybody watching. This is like the key point here.
Yeah. It's a great question. And like I said, we've been learning and talking with independent docs to seeing how their practice have been running. I think when you start out, you have to get a feel for it. You have to understand kind of what is this like? How do I support my practice? But very quickly, as soon as you get out of that point, you should pretty much stop doing that, in my opinion. We want to make it such that this is a no-brainer decision. And in fact, I think you were going to bring up earlier, we are originally at $5 per patient per month, which is for some practices a lot, depending on your location. If you're at $50 a month, that's a tenth of your costs, which I totally understand. That's kind of where we had to start. And we heard from practices that, hey, this is a little too much. And what we've realized is every practice is unique, and you need to be flexible to meet them. So we're actually updating our pricing to be a pay as you go. So how much you use. So it becomes less of I don't believe, a doctor who's caring for patients should ever really be faxing forms, should ever really be calling and waiting on the line, because your time is better spent doing, caring for those patients, building those relationships. So, I think there is, to be tactical about it, there is an inflection point at about 100 where you start to get someone involved. But, it depends. Some people who are really organized can, go all the way up to 200 and they are fine. Mm-hmm. But about the 100 to 200 point is when, you just have too many referrals, too many requests coming in for scheduling, and you should really start to consider hiring somebody, or at least bringing on some support so that you have, it's ironic. You almost come in because you get burnt out from the original system, and then success leads to its own form of burnout unless you're not careful.
Yeah. And I think that's a fair point. You want to make sure that you're focusing on the things that you get the most fulfillment out of. And I don't think scheduling is one of those things, or faxing documents. I agree. So let's get really down to like the value proposition. And speaking from personal experience, I grew my practice up to around 500 patients, and I hired a second doctor, and then we brought on a medical assistant. I don't know if that was a perfect strategy, but we did have, I did have good growth in the beginning, and we continue to have really good growth. So I'm not saying, this is not like a hard sell to my audience. Like, this is not something that you must buy, but, it's definitely something that I consider. Your product came out in April of this year, April 2019. And so I was pretty much full at that point, but it's something I would definitely consider. Now, if you were at $5 per patient and you had 500 patients, that's like $2,500 a month, which in relative terms, that's enough money to hire a medical assistant. Just about, if you hire a medical assistant for around $15 an hour, that's about $2,500 for the month. So now that you've changed your pricing model to that hourly, for somebody with a panel of 500 patients, what does their typical charge look like? Could you give a ballpark or an average?
Yeah, it's so, like I said, we changed it to be flexible. And so some docs have, relationships with MAs and staff that have been on for years, and they come in and they just want us to come in and do document management for them. I will kind of, before we get into that, one piece of this pricing is we're a technology platform on our end too. So we have an entire workflow management tool on our side to make sure that our team is really on top of it, and we can do it in this not only cost efficient but patient centric way. And so yes, we will, for these large practices, just go in and do document management. that could range for as much as 1,000 a month. And what you're doing is you're alleviating your on-site staff, because I'm not saying replace, the people that you've known for years with us. That's not it at all. It's
Sure.
rather we have a team of folks who want to work from home. We employ moms, stay-at-home parents who want to just be at home and be with their kids, but also continue doing the job that they love and have been doing for years. And
Sure.
so,
Let me riff off that. What
Mhm.
kind of credentials are your employees having? Are they registered nurses? Are they medical assistants? What level of training are the people who are handling these phone calls and documents?
Yeah, you covered both of them. So we have medical assistants who are not strictly licensed, but they've been working in the medical profession for at least anywhere from 5 to 10 years, and then we have
Hmm,
registered nurses. So we wanted to make sure that there was amount of knowledge, like clinical knowledge, just
sure.
to triage up into. And this is part of the whole system we have on our back, on the back end, that are tools that we use. When we do have questions, medical assistants can escalate to nurses, and we keep everything running really smoothly in that sense. But to go back to your question on how would a clinic use us? Well, sometimes it would be just document management. That could be range, if there are 500 patients, range on the order of $1,000 a month. But if you are a 500 patient practice and you want us to be doing all of your scheduling and all of your document management and all of your referrals, well, that's suddenly, looking closer to that 2,500 a month price that you said. Um,
Sure.
it is meant to be flexible, though. It's meant to be pay as you go, almost pay by the hour, if you will. The
Right.
analogy would be if you wanted to hire a part-time nurse for 10 hours a week, and first of all, you got to find them. You got to make sure that they're trained. You have to trust them. And what we at Sling Health are saying is, don't worry about any of that. We have vetted professionals that understand DPC and the values of patient-centered care. So we want to make it as no-brainer as possible to say, hey, work with us, because we value the patient relationship.
Awesome, man. Well, I got a couple more questions. Actually, the last question, any success stories or users that you worked with who really benefited from your panel? Any of the DPC doctors that you met that you've been able to make a big impact on their practice?
Yeah. I mean, I think personal impact to the doctors is that they get their work-life balance back.
Hmm.
They are able to get out of the work at 5, go to their families, spend time at home, while also not worrying, okay, if someone messages in now, who's going to answer? If are my patients getting the care they need? So that's one just broad category of it. But I have one particular story that I love to go to, which
Sure.
is it was about 11 a.m. and a patient messaged into one of our docs, and the patient had a headache, I think, and the doc knew that, okay, this patient had past hemorrhage. I'm worried. And so he texted us immediately and said, I'd like this patient to get a CT scan for intracranial hemorrhaging stat. Within 15 minutes, we had called. So, by the way, the doctor had 2 appointments back to back right then. And so he texted, walked into his appointment, and then we immediately called the facility, got it scheduled, contacted the patient, got the patient there. Once the patient had been seen, we got the consult notes from that facility, got it uploaded into the EMR, and the patient was back at home an hour and a half later. All said and done with the notes like nicely tucked away into the EMR. Knock on wood, everything was fine,
Sure.
but it was an example of where this doc who was just, he had 2 patients who were waiting for him. He suddenly had this emergency come in, and he had a reliable team that was able to respond really quickly to the needs at hand. And that's why we started this.
That's
It's exactly situations like that.
that's awesome, man. That's a great story. Perfect illustration of how this technology enabling could help a physician. Last thing I want to do is just wanted to showcase some of your stuff on the website. Just going to do a little screen share here. Boom. That's it. Sling Health. If anybody's wanting to find this one, it's slinghealth.com. And tell me about this trusted by DPC Alliance, Direct Primary Care Coalition, built on Hint. So could you just talk to me
Yeah.
about those aspects of it?
Yeah. Goes back to the tribe. These are folks that from the very beginning, when I started off, when Cassie and I started off, we were in touch with Joe Grundy at DPC Alliance from Direct Primary Care Coalition. Jay Keese actually went down to the DC fly-in and was petitioning out there. And we have a really strong partnership with Zach at Hint Health. They're a fantastic team out here in San Francisco. We met Zach at the Hint Summit that was last year, and so we're working with them together. We have an integration between our two services, and it really does go back to the idea of that tribe. I have loved everyone on the DPC Alliance, the Direct Primary Care Coalition, and the entire Hint Health team, and we hope to just work with more and more folks like that, just trying to push direct primary care across the country.
Awesome, man. Well, we'll leave it at that. I think direct primary care and growth in the DPC model. Hold on one second.
No problem.
All right. All right. Well, we'll leave it at that. I think the growth of the direct primary care model across our country is just unstoppable at this point. And I think having tools like this will give DPC doctors just another option on how they can grow their practices. I really thank you for taking the time out of your day to come on the show. And I appreciate you and the work you're doing to try to further this movement.
Appreciate it. And if anyone's listening, wants to get in touch, please email me at neil@slinghealth.com. Let me know that you heard this podcast with Dr. Paul Thomas, and we'll give you a special free trial to work with our team.
Oh, dang. Oh, that's awesome, man. Well, thanks so much. And thanks for watching our Startup DPC show, everybody. Have a great day, and we'll see you next time.
Perfect.